In integrative medicine, we're using basically whatever works. If nutritional changes work, we'll use it. If vitamins and supplements work, we'll use it. If conventional medicine works, we'll use it. We're willing to think outside the box. So we're going to pretend we're Sherlock Holmes, and the way Sherlock Holmes solved his mysteries was to realize that all possibilities were still on the table until he could prove that it was not that possibility. So that's what we're doing also. In conventional medicine, I was taught to think in a very limited way, and then since then I've had to expand my way of thinking and learn from more sources so that we can consider more options that weren't originally taught to me. So regarding arthritis, the first type of arthritis is osteoarthritis. Osteoarthritis is also called degenerative joint disease. This is basically a wear and tear sort of phenomenon where you get thinning of your joint cartilage, and then you get irritation of the edges of the bone, so they grow spurs. You grow bone spurs around the joint. And then from the thinning of the joint cartilage and the bone spurs, you get a lot of crepitus, which is that kind of, not the joint popping, but the kind of crunch, crunch, crunch when you move the joint, creaking and crunching. Often osteoarthritis is post-traumatic. If you just have it in one joint, if you had a particular joint injury, then that joint will often become arthritic later in life from increased wear and tear. The next type of arthritis is rheumatoid arthritis or inflammatory arthritis. There's actually lots of different types of inflammatory arthritis. Rheumatoid arthritis is just one type. There's also juvenile rheumatoid arthritis, or JRA. There's psoriatic arthritis, so if you have psoriasis, that disease can also end up attacking your joints. You can have something called mixed connective tissue disease. You can have lupus, ankylosing spondylitis, which is more involving the spine, and then infectious diseases like Lyme disease can also cause arthritis. What most of these have in common is they have an activation of the immune system, an inappropriate activation of the immune system, so that you're attacking part of your own body. Now, what I learned in medical school is that your immune system can be confused and attack almost any part of your body that it wants to. There's a name for every disease for a different part of your body. There's a name for the disease where your immune system attacks the tip of your nose, or the tip of your ear, or your gums, or your heart valve, or any other part of your body. It just happens to be when it attacks certain parts of your joint, we call it rheumatoid arthritis. If it does that when you're young, we call it juvenile rheumatoid arthritis. If it attacks that plus some other things and you get a facial rash, we call it lupus. If it attacks mostly your spine, we call it ankylosing spondylitis. And if it attacks a wide variety of kind of weird things, we call it mixed connective tissue disease. In rheumatoid arthritis, you get swelling of your synovial membrane, which is the little membrane that lines the joint and is filled with fluid to act as a shock absorber or cushion between one bone and another bone. And the lining of that joint then gets inflamed from the autoimmune attack, recognizing some protein in that lining and attacking it inappropriately. And that causes swelling, heat, and tenderness, which you really don't have in osteoarthritis, unless that osteoarthritis has gotten to the point where it's really worn down and you're getting a lot of destruction. Then you can have swelling, heat, and tenderness. But that's the big difference. And rheumatoid arthritis itself has about a 60% genetic influence. So if you have, for example, identical twins and one gets it, the other person has about a 60% chance of getting it, as opposed to 1% chance for the general population. So that's dramatically increased genetically. Now, what's the usual treatment for treating the pain of osteoarthritis? It's pain medicines like ibuprofen or anti-inflammatories. These are called NSAIDs, or non-steroidal anti-inflammatory drugs. And NSAIDs are like cutting the little wire to your check engine light. They do stop your pain, but they do nothing to stop the process of the joint degeneration. In fact, they speed up the joint degeneration because they inhibit the prostaglandins, which create joint cartilage. So they actually thin out your joint cartilage faster than if you didn't take anything. And they worsen the long-term outcome of osteoarthritis or rheumatoid arthritis. But all your joints get worse by taking non-steroidal anti-inflammatories. Now, they're great for acute injuries. You got to take them for 2 or 3 weeks after an injury, fine. But to be on these drugs long-term for month after month causes real problems. And they're one of the leading causes of death and hospitalization in the United States, because the prostaglandins are also inhibited that create the mucus lining protection of your stomach. And without the mucus to protect the lining of your stomach, the acid in your stomach will eat holes in it and you get ulcers. So non-steroidal anti-inflammatory drugs cause ulcers and gastric bleeding. In fact, they kill 16,500 people per year in the United States and hospitalize over 100,000. That's the 15th most common cause of death. Okay, so what can we do besides taking these pain medicines, which may make you feel better short term, but actually increase your incidence of disease long term? Well, we can use natural anti-inflammatories. We can attack the inflammation that's causing the joint problems with a number of herbs and natural products. Curcumin right now is my favorite natural anti-inflammatory. That's what's the turmeric that's in curry is actually curcumin. In fact, that's one of the reasons why there's such a low incidence of Alzheimer's disease in India, because they use turmeric in their cooking, and this is a brain anti-inflammatory also. And Alzheimer's disease, to a great part, is inflammation of your brain. Ginger is a spice, of course, and is a very wonderful anti-inflammatory. Boswellia is a resin from a tree that has good properties. Cayenne is hot pepper extract and also decreases inflammation. Bromelain is pineapple enzyme. White willow bark is where aspirin was originally derived from. It's the natural component that originated aspirin. And then essential fatty acids come from fish oil or flax, and these decrease inflammation. I'll go into more depth on these. But one of the most powerful remedies for osteoarthritis is glucosamine. Glucosamine sulfate is the precursor for your joint cartilage. So when you take glucosamine, it's been shown to actually thicken your joint cartilage. And within 6 to 12 weeks, it's better at reducing pain and symptoms than taking the nonsteroidal anti-inflammatory drugs. The NSAIDs, or painkillers, will make you feel better for the first few weeks, but within 6 to 12 weeks, glucosamine catches up and then bypasses it because the anti-inflammatories are thinning out your cartilage, and this is thickening your cartilage and healing the underlying damage that's causing the problem. There's been several studies, numerous studies on this, and just last year, a 5-year study was done on glucosamine, showing that the longer you take it, the better it works. It keeps working. So don't take it for a little while and then stop. This is one of those things you just kind of keep taking for long periods of time. However, what works very well with glucosamine is MSM, methyl sulfonyl-methane. This is basically the oral form of DMSO. Many people are familiar with DMSO. It's a liquid that you can rub on the skin, and it carries things into the skin. It's a penetrating agent. And DMSO has often been used in physical therapy and sports medicine to carry anti-inflammatories and pain medicines locally into a joint. And basically, MSM is the stabilized oral form of this. But niacinamide you can use at very high dosages, at least 3 or 4 times a day. And for a certain percentage of people, that helps. In my experience, it's only about a third or fourth people that helps dramatically. But when it does help, it helps quite a bit. And niacinamide is quite inexpensive and quite safe. Niacinamide's also been used to help treat schizophrenia and bipolar disorder. So it has remarkable effects on brain function for some people. Bromelain is an enzyme derived from pineapples. If you take this with food, it'll help you digest your food. But if you're having arthritis, that's not when you want to take it. You want to take it on an empty stomach, which means at least a half hour before you eat or 3 hours after you eat. If you take it on an empty stomach, it'll actually go into your small intestine and be absorbed across your gut lining and go to the site of inflammation in your body and decrease that inflammation. It kind of eats up the inflammatory molecules that are going on at the site of redness and swelling. So this can be very good, especially for acute injuries or for long-term inflammatory types of problems. So I usually use bromelain when people twist their ankle or have an acute sports injury. I have them take it after surgery, and I have them take it 3 times a day on an empty stomach, and usually do that for a few weeks at a time. I mentioned ginger. The easiest, or at least the least expensive way to use ginger is just to drink ginger tea. You can get tea bags of ginger, or you can get fresh ginger and just chop it or grate it up and pour boiling water over top of it. You want to cover it because the good part evaporates off. It's the volatile oils, or the parts that turn into air that you want to keep. So you want to steep the ginger covered, and you can just drink that tea. It's also a very good tonic for your digestion.